Hello, I am Dr. Sangeetha. I am a fertility specialist. I am into reproductive medicine and cosmetic gynecology, practicing at Coral Advanced Fertility Center, New Bell Road. Being a woman is wonderful. Women is the pillar and important person in a family and in a society. So her health is of utmost importance, which is often neglected. So health screening or health checkup for women is very important, and that's the best gift you can give to your woman of life, whether it's a mother, daughter, wife, or a sister. So we have to screen every woman who have symptoms immediately. So if they are asymptomatic, please just make sure that every woman undergoes a health checkup after 30-35 years of age. Especially we are worried as gynecologists for the important cancers, that is the cervical cancer, endometrial cancer, ovarian cancer, and breast cancer. So there are simplest methods which we can tell them, which we can add into their screening things, and which we can do on day-to-day basis. So it is very important they undergo health screening or health checkup starting from 30 years of age. And I personally recommend females in their reproductive age group starting from their first cycle, that is during puberty, to menopause or postmenopause, to undergo some screening or some counseling with a consultant, so that they will know from the first cycle what we have to do. Educate them is about menstrual hygiene, nutrition, and lifestyle changes which will keep them in their good menstrual health. And followed by they can do self breast examinations, wherein we teach them how they can just inform us if they find some abnormality in their breast. So that is a form of breast cancer screening. If there are any abnormal masses or tumors or something, if they can find a lump in the breast, it's very important for them to report to us. So when we come productive age group, females that who have already started their sexual activity, we have to definitely screen them for cervical cancer using papsmear tests, HPV, that is human papilloma virus tests, colposcopy, hysteroscopy, or laparoscopy, depending on whatever symptoms they present. If there are any lesions or any mass or any growth which we find suspicious, we have to definitely subject them to some procedures. So screening is very important. And apart from all their medical health problems, like if she might be anemic, she might be diabetic, she might be hypertensive, she might have thyroid problems, she might have any other hormonal imbalances, which will be screened, and she can start the treatment at the earliest. And we all know starting the treatment at the earliest will save money, time, and the patient doesn't have to go through the severity of the disease. Well, if they come in the later stages of the disease, it is not possible for any doctor to treat them completely. So to keep up their good health, they have to undergo health screening at the earliest, and they have to undergo some simple tests, like wherein we check their hemoglobins, we check their peripheral blood smears, we check their HIV, HBsAg, or any other sexually transmitted diseases if required. We check their HbA1c or sugar levels. We check their thyroid profile, liver function tests, renal function tests, their coagulation profile, or any other things which are deemed necessary according to their symptoms or history or their family history. We just make sure that the woman will be healthy, because we have improved the quality of life. So we no longer live till 45 to 60. Our life expectancy has crossed 60-70 years. So there are a good number of women living beyond 60 years, working beyond 60 years. So it is very important for the woman to take care of the health of their own health as early as possible. And so screening is a must, and it should be added like any other thing. And including the screening are simple things like vaccination to prevent the cancers, and we have to do some examinations every 2 to 3 years like pap smears and HPV virus. So all these things can definitely prevent her from going into these severe stages of cancers or any other diseases. And there are also other non-cancerous lesions which can be treated early, and There are simple things like infections, white discharge, some bleeding problems, which they neglect so much and they have to suffer, and nobody will take care of the woman if she doesn't take care of herself. So anything from the smallest thing of menstrual irregularity to white discharge per vagina or to some itching or whatever she feels, she has to consult. And vaginal health, reproductive organ health is very important for her to lead a happy and healthy. Every woman should undergo health screening with the consultant, and I preferably want her to undergo every year, but at least once in 2 to 3 years she has to undergo all the basic tests along with cancer screening and other special tests as required according to their conditions. On the eve of National Women's Health Week, that is starting from Mother's Day, from May 12th until May 15th, we will be conducting several screening camps for women to screen for cancer, to screen for fertility issues, or any other reproductive issues, along with general screening.